Imagine going to a hospital for a routine procedure. Later, you receive the bill. Everything seems expensive, but one line stands out. Tylenol. The same medication you can buy at a pharmacy for a few dollars is suddenly listed at $30, $40, sometimes even $50. Stories like this circulate constantly online. People joke about the $50 Tylenol. But behind the joke is a real question. Why does a simple over-the-counter medication become so expensive inside a hospital? Is it price gouging? Billing errors? Or something deeper inside the healthcare system? Today, we're going to break down exactly why this happens, and why the answer reveals a lot about how hospital pricing actually works. The famous $50 Tylenol example has become symbolic of healthcare costs. But the truth is, it's not just Tylenol. Hospital bills often include surprisingly expensive line items, such as $200 for a bandage, or $100 for a pair of gloves, or $500 for a simple blood test. At first glance, these prices feel absurd. After all, these items are inexpensive in everyday retail settings. But hospitals don't price services the same way stores price products. In fact, the price listed on a hospital bill often reflects something very different from the cost of the item itself. To understand why, we need to look at how hospital pricing systems evolved. Why the Tylenol story spread everywhere. Part of the reason the $50 Tylenol story became so famous is that it highlights something people rarely see in everyday life. Most industries operate in highly competitive consumer markets. If a grocery store tried to charge $50 for a bottle of Tylenol, customers would simply shop somewhere else. But healthcare doesn't operate under the same conditions, as patients usually don't choose medications during treatment. Doctors prescribe them, and nurses administer them. And patients often see the price only after care has already been delivered. Because of that structure, traditional consumer price competition rarely occurs inside hospitals. This creates an environment where prices evolve through negotiation and institutional cost structures rather than direct consumer comparison. The Tylenol example became viral because it reveals that difference instantly. It shows how healthcare pricing follows a completely different set of rules. One of the most important things to understand about hospital bills is that they don't function like normal receipts. Hospitals don't calculate the price of each item the way a grocery store does. Instead, many charges are structured to represent a bundle of costs related to providing care. That includes pharmacy operations, medication storage and safety systems, pharmacist oversight, nursing time, electronic medication tracking, and regulatory compliance. When a medication is administered in a hospital, the charge may include far more than just the pill itself. The pill might cost pennies, but the system that safely delivers that medication to a patient costs much more. Hospitals operate under strict medication safety rules. Every medication administered inside a hospital must be verified by pharmacists, tracked electronically, stored securely, matched to the correct patient, and recorded in medical records. Many hospitals use barcode scanning systems to ensure the right medication reaches the right patient. Pharmacists review orders to prevent dangerous interactions. Medication carts and automated dispensing machines track inventory. All of this infrastructure exists to reduce medical errors. And maintaining that system requires staff, technology, and oversight. Those costs often get distributed across medication charges. Hospital pharmacies also operate very differently from retail pharmacies. Retail pharmacies fill prescriptions after a doctor writes an order. Hospital pharmacies operate continuously. They must be ready to prepare medications immediately for emergency patients, intensive care units, and surgical procedures. They maintain large inventories of specialized drugs. They also handle sterile preparation of medications that must be carefully compounded. This 24-hour readiness adds operational costs that retail pharmacies don't face. Again, these costs often become embedded in medication charges. Hospitals must be ready for anything. Another factor that increases hospital pharmacy costs is readiness. Retail pharmacies mostly fill predictable prescriptions, but hospitals must prepare for unpredictable emergencies. They must keep large inventories of medications available immediately for situations like trauma cases, cardiac emergencies, severe infections, and surgical complications. Many of these medications are expensive and rarely used, but hospitals still need to keep them in stock. Pharmacists and pharmacy technicians must also remain available around the clock to prepare medications on demand. This readiness model ensures patients can receive critical medications without delay. But maintaining that level of preparedness adds significant operational cost. Those costs often get distributed across many medication charges, including simple medications like Tylenol. Another major factor behind high itemized charges is something called the hospital charge master. The charge master is a massive internal pricing list containing tens of thousands of billable services and items. It includes everything from medications to surgical supplies to room charges. These prices often appear very high because they are not intended to represent what most patients actually pay. Instead, they serve as starting points for negotiations with insurance companies. Insurance providers typically negotiate significant discounts off charge master prices. Medicare and Medicaid use entirely different reimbursement formulas, so the price printed on the bill may not reflect the final payment the hospital receives. Because of these negotiations, hospitals sometimes set high list prices for individual items. This creates flexibility when dealing with multiple insurers, each with different reimbursement agreements. Hospitals must balance insurance negotiations, government reimbursement rates, uninsured patient care, and operational costs. Setting higher baseline prices can help ensure the hospital receives enough revenue after negotiated discounts are applied. This system can make itemized charges appear extremely inflated, even though the final reimbursement may be much lower. Another hidden factor is that hospitals often redistribute costs across services. Some areas of healthcare lose money. Emergency departments, trauma care, and certain specialized treatments can be extremely expensive to operate. Hospitals sometimes offset those losses through higher pricing in other areas. This means certain services, including medications, may help support other parts of the hospital's operations. The system isn't always intuitive, but it reflects the financial balancing act required to maintain a full-service hospital. Why hospital bills look so detailed? Another reason these charges stand out is how hospital bills are structured. Hospital billing systems tend to list every component of care separately. Each medication, each supply, each service. When patients see these detailed line items, they can appear surprisingly expensive on their own. But hospitals are essentially translating an incredibly complex medical process into an itemized financial record. That process includes thousands of individual actions performed by doctors, nurses, pharmacists, technicians, and support staff. Billing systems attempt to capture those actions through codes and line items. The result is a document that can look overwhelming and sometimes illogical to patients. Yet behind each line item is part of the infrastructure required to deliver modern medical care. The $50 Tylenol example sticks with people because it feels like the simplest symbol of healthcare pricing confusion. When patients see a familiar medication listed at a dramatically higher price, it highlights how different hospital billing is from everyday purchasing. Hospitals are not simply selling pills. They are operating complex systems designed to deliver safe medical care around the clock. The cost of that system becomes distributed across thousands of small charges. Understanding that doesn't necessarily make the bill feel reasonable, but it does explain why something as simple as a single Tylenol tablet can reveal the deeper economics of the entire healthcare system.